Good night, Dr. Andrés Rodríguez and students. My name is Christian Rer. I will give an answer to point 4 of the form by Dr. Andrés Rodríguez. 4a. Ventricular septum defect. True. The VSD consists of incomplete closure of the ventricular septum, which allows the passage of blood between the ventriculars. The large communications are usually of the membranous or infundatory portion and usually produce derivation from left to right in significant way, which generates right ventricular hypertrophy and early pulmonary hypertension, whose most characteristic symptom is advanced stage is cyanosis due to narrowing or destruction of arteries and pulmonary capillaries. 4b. Atrial septum defect. CIE is a congenital hair defect in which the wall that separates the atrial doesn't close completely. Patients usually have no symptoms and children with atrial septum defect will grow slowly. However, in the first years of adulthood or middle age, unruly atrial septum defects, particularly those that are large, can cause stroke and or pulmonary hypertension with cyanosis and its main characteristic. 4c. Patent ductus arteriosus. The following congenital hair lesions are cyanotic. Persistent ductus arteriosus has variables that determine whether present cyanosis or not. Of symptomatic type, it can be the cap funnel type, in which the clinical manifestations are minimal and there is absence of cyanosis. On the other hand, the window tip CAP is a significant variant because the diameter of these communications cause a reversal of the ductal flow, or Einstein-Major syndrome, where there is an inversion of the blood flow original from the left to right and therefore the cyanosis. The diameter of the CAP determines is cyanosis occurrent. 4d. Tetralogy of Fallot. Tetralogy of Fallot occurs due to a combination of 4 cardiac defects as a result of anterior superior displacement on the infundatory septum. The clinical consequences depend on the subpulmonary stenosis, as this determination the direction of blood flow. If it is a mild, it normally looks like VSD and the derivation from left to right without cyanosis. On the other hand, when the obstruction of the right ventricular outflow is more severe, the pressures of the right side approach or surpass those on the left side and derivation develops from right to left, generating cyanosis. Most infants with this condition develop cyanosis from birth or soon after. 4e. Transposition of the great vessels. The transposition of the great vessels is a disease that generates ventricular arterial discordance. This transposition changes the way blood circulates through the body, which leaves a shortage of oxygen in the blood that flows from the hair on the rest of the body, so that the patients will see cyanosis. Without an adequate supply of oxygen-rich blood, the patient will die if not treated.